Good afternoon, ladies and gentlemen. This is Holly LeMaster from the Colorado MESA Initiative. I'm sorry we're a couple minutes late today. We had a slight technical snafu going on, but I think everything's okay now, and we are ready to get started. So thanks for joining us. Before we get going, I want to point out that your GoToWebinar control panel can be minimized if you are having trouble seeing your screen. And if you're having trouble hearing, the instructions for dialing in over your telephone are located on this slide. I'd like to just do a test right now and make sure you folks can hear us. So if you would click your little yellow hand-raising icon, that will help me to know that we are in fact broadcasting and you're able to hear. All right, great. I see a few hands going up. We will be taking questions and giving answers at the end of the webinar, but you can type them in at any time. So on your control panel, you'll see the question box. You can type in a question as it comes up, and we will address those at the end of the webinar. There are handouts available for today's information on our website at coloradomesa.org. You will have to sign in and go to the events area and look under upcoming webinars for today's show. And after Monday, we'll have the recording of today posted, and you'll be able to sign in, go to the classroom section, and then watch the recording of the webinar and also download the handouts from there under Webinar Archives. So the Colorado MESA Initiative, as most of you probably know, is an acronym, stands for Medicare Experts Senior Access, and we are all about helping primary care providers be more adept at their Medicare coding and documentation and also more comfortable taking care of seniors. We're a collaboration between the Alzheimer's Association of Colorado and the Senior Care of Colorado IPC practice. We are funded by the very generous Colorado Health Foundation, as well as Kaiser Permanente Foundation and Caring for Colorado. And so today we are going to talk about audits, as you know. And I just want to, many of you have heard this in our live workshops, but to sort of orient and frame the conversation for today, let you know kind of where we come from in the MESA initiative is absolutely providers all have to know how to document and code appropriately. And what we see out there is not so much that people are overcoding, although that does happen sometimes, usually not with malicious intent, but sometimes it happens. But the big problem that we see is that providers are undercoding because they're afraid of being audited. What we really believe is if you know the guidelines and the letter of the law and you understand that and you follow it, there's really no reason to worry about being audited. You can just say, bring it on, auditors. Invite them in for a cup of tea, as our Dr. Ruskina likes to say, and know that you've done everything right and you don't have to be worried. We also encourage you to perform internal audits regularly, and there are a lot of things that you can do to be prepared and feel okay about this so you don't have to be worried. And that is precisely what we're going to be talking about today in a special presentation called Understanding the Audit Process. So we have two great guest speakers with us today. The first one is Merri Faretto, and she's with the Toiyabe Group. She's the Operations Officer and Director of HIM Coding and Compliance. You can see all of her credentials here, and obviously she is an expert in coding and compliance. And also Nancy Enterline, also of the Toiyabe Group, and she also has many years' experience in healthcare administration and operations, and she is currently the revenue cycle analyst at the Toiyabe Group. So I would like to welcome our two guest speakers today, and they are going to get into the ins and outs of understanding the audit process. So bear with me here while I hand the presentation over to Merri. And Merri, whenever you're ready, you can take it away.
Thank you, Holly. We're going to talk to you about understanding the audit process and the steps that Toiyabe assists providers in educating and how to properly document and code. So our agenda today is first identifying what is a coding audit, different types of audits, and why an audit is important, both from an educational standpoint as well as from a compliance standpoint. And TTG, we're the Toiyabe Group and our audit process. And then we're going to help you get started with your audit. So what is an audit? Simply put, it is a process to verify that what you're billing is supported by the provider documentation. So as we've all heard, this has been drilled down. If it is not documented, it did not happen. So again, what you're billing, you have proof. You can prove that you provided those services. So different types of audits. I'm sure you've all heard of the RAC, the Recovery Auditor Contractors. Here on the West Coast, we see the RAC, we call them, we're being racked quite often on the West Coast. We're also starting to see MECS, which is the Medicaid Integrity Contractors. Other audits you might have experienced or know a little bit about is the ZPICs, the CERTs, and the PERMs. Commercial payers, again, those you might even be audited by your commercial payers and not even know that you're being audited. When your commercial payers are requesting medical records, they're essentially looking at that documentation and proving what is on the bill. Going back to the RAC contractors, I just want you to know that they're contracted with the government and they're incentivized to find errors on the claims. They get money for finding our problems and if we're not compliant. So being incentivized really causes them to dig. So that's why it's very important that our documentation supports every service we're billing. Our focus at TTG is mostly internal audits. Why do an internal audit? I'm going to let Nancy explain this a little further.
First of all, when you're doing an internal audit, you are preparing yourself so that when you get audited by a third party, that you are totally compliant with the law and that they won't find any errors in your documentation or your coding. At TTG, we do an individual physician review. We look at documentation issues which frequently certain physicians in your practice may have different methods of documenting. Some doctors are dictating, some doctors are using Dragon, some doctors are using a point and click in an EMR. We look at those different methods and styles to see if there's discrepancies between the methods and styles that might flag an auditor to drill down and concentrate on one style. We look at coding trends. Frequently, physicians will be very accurate in their lower E&M levels, but get a little bit fearful at their higher levels and either over or under code. We're also looking at your charge capture to make sure that you're capturing every single service that you provide in your documentation in order to bill for them. And then with the individual physicians, we're identifying weaknesses. For instance, a practice that we audited recently, the physicians used an EMR in their physician practice office setting, and their documentation was excellent, but they were dictating in their hospital setting and their outpatient hospital settings, and their documentation was not very strong at all, and their audit, they were consistently over-coding. We're also going to look at educational opportunities in case we identify a trend of weaknesses within a practice.
Our audit process, they can either be random audits or focused audits. Random is when we typically ask for the universe of a certain time frame, and then we go in and we select. So it's unbiased. It's an unbiased audit. A focused selection is typically when a provider or a facility has identified a problem already and they would like us to focus on a certain area that they're having a problem on so we can see how wide or how extensive that is and what the education needs might be. When we do an audit, of course, we always want to be consistent with our audit criteria. And the focus of evaluation and management audits we're going to use the national guidelines, either the 1995 or 1997. Whichever ones the practice, whichever guidelines the practice uses is basically the guidelines that we should be auditing from. We want to be consistent with our guidance. Our audit focus will look at the evaluation management. We will make sure that if you're billing new patients or established patients or the different settings that you're providing the services, that we're getting those components, meeting all those components of your HPI, your exam, and your medical decision making. We also look at what else is being billed, procedures. Are they being supported by the documentation that you provided us for that data service? And, of course, diagnoses. Diagnoses are important because it satisfies medical necessity. Your diagnosis supports why you did that EKG or why you ordered that chest x-ray. It also supports higher level E&Ms if you're evaluating multiple conditions or conditions that have exacerbated. So essentially, does your documentation reflect the conditions and services billed? That is typically what any auditor is focusing on. Go ahead.
So at the end of our audit of your charts, we would make recommendations based on our findings. We will give you an audit report that will talk to you about missed coding and billing opportunities, and we'll focus on documentation improvements for each physician. They'll talk about compliance issues that may have been identified and what kind of educational opportunities that we might find. And we have already started auditing for Colorado MESA, and we have found some trends in the multiple practices that we have audited. One issue that we have seen is some physicians are using Dragon naturally speaking. And I'd like to give you an example of a Dragon statement in the history of present illness. The doctor states, he is here today for sore throat. He also says back pain for 1 week. Shut the door, I need 5 more minutes. That is not appropriate for a medical record, and so we would like to encourage you, if you are using Dragon, to please proof your work before you sign your chart. We've also seen the use of templates in either Dragon or the point-and-click EMRs, and so frequently we see some problems with consistency within the chart. We had a statement recently during the HPI that the patient was profoundly deaf and was concerned that they might need new hearing aids. In the review of systems, the template stated no hearing loss. In the physical exam, the template stated no hearing loss. And in the medical decision-making portion of the chart, the patient was referred to an audiologist. This type of inconsistency flags an auditor to delve more completely into a physician's charting and frequently will cause a larger audit than was originally planned for that physician. We've also noticed some trends in the chief complaint. The patient is here for follow-up. The chief complaint must be a descriptive statement describing what the patient is here for today. And so, for instance, you could say follow-up on last week's sore throat to completely satisfy that element. We also see a problem in the HPI where the patient is obviously describing some condition to the physician, but the physician is not completely documenting the patient's statement. For instance, patient here for sore throat only satisfies a brief level of HPI, but if you had said something like, patient here for a sore throat, progressively worse over 3 days, it feels like a knife is stabbing me, and it's much worse when I'm drinking tequila, you would satisfy enough elements to have an expanded review of systems. After we go over the report, we will also have a follow-up conference call for questions and answers with the physician in case there's particular issues that the physician wants to discuss with the auditor on their cases.
So audit tips. When we request records or when you send records, remember that each date of service must stand on its own. So we request that typically we want to see the 1500 so we know what diagnoses were reported and what codes were being billed, and then that medical record documentation that you provide us, that we have all the components. So again, if you're billing for a chest x-ray, that some of that documentation must state chest x-ray provided and what the doctor his findings from reading the chest x-ray. Don't bill for diagnoses that were not treated or evaluated during a certain visit. An example is, I know providers keep running problem lists. They might keep it on the inside of their chart, and I've seen where we've had diagnoses billed, but my provider note does not mention anything about those conditions, such as the sore throat. We're coming in with the sore throat, but we also bill that the patient has hypertension, osteoarthritis, and diabetes, hyperlipidemia. But my record does not support any of those conditions. An auditor will look at that. Remember, each date of service must stand on its own.
So if you make a note on an x-ray result or a lab result and you do not reflect it in your dictation or your chart note, when you are sending the records to the auditor, please do send the result note also so that that can be considered in your E&M level.
So again, clear, complete, and accurate. Document what you did for the patient. If it's not documented, it did not happen. So this slide is one of my favorite slides about documentation. It is about the total revenue cycle. So it's your provider documentation will support the medical necessity of the visit. It will lead to accurate coding, which leads to billing efficiency. And of course, billing efficiency leads to increased reimbursement potential.
And most importantly, your documentation in your chart will support you and protect you in case of a legal case. If your documentation reflects every single thing you did during the patient encounter, you are completely protected.
And it will help you if you are deposed when you're reading your record 3 years later, you know, to be confident in the service you provided. Getting started, we are asking for 5 notes per physician. Documents that are required to do your audit would be the medical record applicable for that date of service that you've selected to provide us, the CMS 1500, and an encounter form or super bill if you use that. And the reason that that is important is it helps us identify if there is a translation problem going from the medical record to the encounter form or super bill, or if my biller might be transposing numbers, or if the error is on that side. So if you're using an encounter form or super bill, like in some practices, we mark those things off. That helps us identify where there might be a problem with translation. And then provide us a contact person. If we have questions or missing documentation or some confusion, because our job is to assist you and to provide that education and positive feedback to help you do better moving forward, we would need that information to assist us in doing the good job for you. We want to thank your time. Holly, thank you for having us. And we look forward to seeing all of those notes.
Yeah, great. Thank you, Mary. Thank you, Linda. I am going to switch back over to my slides here and talk to you all just a little bit more about the Progress Note Review Program and the way that you can access this auditing service that's provided by Mary and Linda and the Toiyabe Group. We call this our Progress Note Review Program. We were calling it an audit, but we thought that was scaring people. So we have renamed it to the Progress Note Review Program. And this is a free service to you. It's provided through our grant funding, through the MESA initiative. And it's your opportunity, if you're concerned about whether or not you're doing something right, and particularly if you have a specific area of concern or certain types of visits that you're not sure about, or even if you just want a general look at how your providers are doing, Mary and Linda will be able to give you that real-life feedback on your actual notes and billing. This is a totally confidential educational process. So the results of the audit are between you and your auditor, and they will be reporting just the aggregate information to us at the MESA initiative just so that we can use the trends and the types of issues and the problems that people are having to further develop our curriculum going forward. So this is not reported anywhere externally. It's just within you and the auditor and the MESA initiative. This is pretty simple for you to put your notes together and submit them. I know we've had a lot of interest when we talked about this in our live workshops, and people are very enthusiastic and they say they're going to do it, and then for whatever reason they don't. So we really want to encourage you. It's not that much work to pull it together, and the value that you will get out of it is really really great. And so quick turnaround time, I think, Mary, did you say about 7 to 10 days usually, depending on how busy you guys are, to turn results around?
That it was what we were hopeful for. But again, this is a new process for us working with your group, so we have identified a few things that have kind of held us up, but we are done with our first set of positions, and within the next week or so be able to contact them and have a quick presentation. So I'm saying between 2-3 weeks,
okay,
or at the very outside.
Okay, great. That's wonderful. And can you describe a little bit about the report that you give people with your findings?
Actually, we do a spreadsheet analysis, so every provider will have his own spreadsheet. It's on an Excel format. It will list what was coded, what was billed, and then we have a comment section. We have a comment section about whether we agree or disagree. So it will show the code. Did we agree with the code? And
if we don't agree with the code, we'll make a comment about why not. For instance, maybe the review of systems was inadequate. Maybe the new patient code required 3 elements and they only met 2 elements. We will put a comment in there.
And then based on our analysis of that provider, we are making our side notes on recommendations. And so we will submit that audit information back to the provider and then ask for a quick appointment. It could be anywhere between 15 minutes to a half an hour, and just describe in further detail, allow the provider to be able to ask questions, and then how we saw it as auditors looking at their clinical documentation.
Great. And then the office manager, or if they wanted other people to be involved, could participate in that call as well?
Right. That contact person, we will be working with that contact person to set up the meetings, and it will be up to the individual group or provider on whether they want to handle it as a group or whether they want to have individual time.
Great. So we can customize that to each group.
So it's very important for us to contact person so that we can arrange these meetings without encumbering the physician time.
Right, right, great. And we had a brief discussion yesterday as we were preparing for this webinar around the degree to which they need to be eradicating patient information. Do you want to share that with them as well?
Yes, they can simply redact the patient name and social security number. We have a secure website to receive their information if it is scanned. And we have a business agreement with Colorado MESA so that we will be able to take that information. Their staff does not need to take a whole lot of time lining through redacting every single bit of information. If they would simply redact the patient name and the patient social security number, that's all we need.
And leave you something to identify the record by, so you can say, oh, go back and look at this chart or this patient ID number, so that you can, the practice can then, recall and be able to look back on the whole record, correct?
Yes. So we need the date of service and a patient account number or an encounter number, something like that. It has come down to times we need a male with the birth date of February 18th, 1949, and that's a little bit awkward. It helps if we have more information.
Yeah, okay, fantastic. So to all of you out there, if you would like to participate in this great opportunity, you can go to our website and download the instructions. There's detailed information about what information to pull and how to either upload it or mail it to the Toiyabe Group for the audit. And if you do not have access to get to the website and pick that up, you can either call or email me. My contact information is there on the screen. So, Merri, Linda, anything else you'd like to add as closing comments before we open up for questions?
No, go right ahead, Holly.
Okay, great. So if anybody's got questions out there, you can type them into your control panel, and we will be happy to address them. And I'll open this up right now. I don't see any coming in right now, but go ahead and take this opportunity to type things in if you've got something to ask. And meanwhile, I will remind you to please go to our website, which is coloradomesa.org, and take advantage of all the amazing resources that are out there. You can find out when we're going to be in your neighborhood. And I guess would love to take a moment to give a shout out to everybody who came out to see us on the road in September and October. We did a lot of workshops all around the state and had wonderful turnout in many, many communities. We were in northeastern Colorado, we were in southeastern Colorado, we were in the high country and all the way out to Grand Junction and Fruita. So thanks to everyone who came to the workshops, and we're just delighted to be able to meet you all and hopefully help your practices. So, excuse me, to access the classroom section on the webinar or on the website, as a reminder, you'll need to sign in. And once you do, the classroom will open up. You can find all of our archived webinars, our handouts, training videos, the discussion forum, all of that great stuff is there. So please take advantage of it. And as we mentioned, this webinar will be archived on Monday. So if you'd like to share it with your colleagues or other physicians in your practice, please feel free to do that. And our next webinar will be on Friday, December 7th. Can you believe it's December already? As always, 12:15 to 12:45 p.m. We have not settled the topic yet, but we will let you know just as soon as we do. And look out for our newsletter, and you'll be able to get the link to sign up for that. So I don't see any questions for Merri or Linda right now, so I would like to thank you all for participating and say thanks again to Merri and to Linda. And we will all look forward to receiving your notes, and please take advantage of that and go ahead and send those in, and they will give you some great feedback. So happy November, everybody, and we'll see you at the beginning of December. Take care.